All right, whether you're a high-level athlete or Renee, just someone who wants to keep up with that New Year's resolution, you don't need to live with pain.
You know, I was on a basketball team. Orthopedic surgeons specializing in addressing pain, and we're talking about how with Dr. David Cohen, an orthopedic surgeon and sports medicine specialist from Connecticut Orthopedics. Good morning, doctor. I tried to already recruit him for myself.
I know. You have no cartilage in your knee, is that right?
In my left knee, but I'll tell you what, that's probably common for a lot of athletes, right?
It's a very common problem we see every day.
Tell us why you went into this particular profession. I always find it fascinating as to the routes.
So, you know, I grew up playing lots of sports. I played football in high school, but really my main sport was ski racing. Ski race throughout college, ski race for Dartmouth. You know, very high level at one point in my life. So I saw a lot of injuries, a lot of ACL injuries, a lot of shoulder problems, a lot of the wipeouts and all the consequences.
Absolutely.
So it was always an interest, and you know, had to make those decisions, and always loved it. So
that's terrific.
Well, speaking of some of the injuries you were just talking about, what are the most common injuries you see on a day-to-day basis, and are they specific to age or sports or just daily lifers like me and Scott?
Right. Well, it's a good question. So you guys are like my typical patient.
Oh, okay.
So what I do is I'm an orthopedic surgeon. That means that I went to 4 years of medical school, then 5 years of orthopedics training, which was really focused on all the body parts, because in orthopedics we kind of divide you up and break you down, and we all have our specialties. And then another year after that, I did what's called the sports medicine fellowship. So that works on mainly knees and shoulders and sports-related injuries. But, you know, my practice is really all about athletes of different ages. So I'll see like elementary all the way up through 90-year-olds. I take care of high school teams. I've been the team doc at Quinnipiac for 20 years.
Oh my God, that's incredible.
You know, but a lot of my patients are just like middle-aged athletes and active people who are working out.
Right.
Want to keep doing their thing.
Well, you know, when should we come see you? At what point does the pain threshold get to a point where it says, like, hey, I need a doctor?
Right.
You know, it's funny. You know, people, I think, have a misperception of going to an orthopedic surgeon. You think it's a surgeon.
Right.
So
automatic surgery,
do I need surgery? They're going to just tell me I need surgery, and I think that's really not true. And I would say 80% of what I do is non-operative.
Wow.
And so when things are bothering you, I think you want to get, you know, an orthopedic surgeon's advice.
Okay.
You know? So from my standpoint, it's very age-related. I see a lot of overuse of things in, like, you know, high school athletes, runners, knee pain, swimmers with shoulder pain, kind of overuse. You're doing more. And these days, everyone's playing 4 seasons of everything, no break. It's the same sport over and over.
I know, right?
And then you get the sort of middle-aged crew, and we're like, all right, this year I'm going to start my workouts again. And you go back and you think you could do what you did when you were 20.
That's exactly what's going on with me right now.
Yep.
And it's not true.
What makes Connecticut Orthopedics so unique?
You know, we're a great group, if I do say so, because we're so patient focused. You know, we're not a teaching hospital. We're a group of highly trained specialists who, and we run our own practice. We are focused on the patient satisfaction. Our staff is amazing. They're very orthopedically focused, very kind, supportive people. And we have all the aspects of orthopedic care in our office. We have MRI, we have therapy, we have, you know, all the testing, many of the like EMGs, the nerve test, all the stuff is there, so we can very expeditiously get you diagnosed and on to recovery.
Okay.
And you have an event going on tonight with teddy bears.
We do.
Oh, is this the ice hockey game?
This is the ice hockey game.
Oh my God, this is so much fun.
Yep, we're raising money for CCMC and support some of our colleagues who are in need.
All the information is right there. The game is 7 p.m. tonight, and Teddy Bears Toss is hosted by Connecticut Orthopedics. I didn't know you guys were the host. That's so terrific. Thank you for doing that. Again, it's Friday, January 12th tonight, M&T Bank Arena at Quinnipiac University. You can go to ct-ortho.com for more details. Dr. Cohen, thank you so much for being with us.
Thanks for having me.
It's great. I got a pain in my knee I want to talk to you about after the show.
We'll talk in the back.
All right, very good.